This is extraordinarily simplistic advice. Take no risks and don't get ill. Well, how are you supposed to not get ill?
Tricky. Yeah, tricky. I mean, yeah, it's ridiculous.
Oh, I won't have this heart attack.
I know. I mean,
not today.
I get earache every morning from it. And, look, you've got to carry on your life as normal.
Of course you do.
Of course you have.
That's what you have to do, and you've got to hope. But it is interesting because the public's on the side of the doctors and not the government.
But it's similar to when we had the ambulance strike. The number of calls, 999 calls, fell dramatically. Whether that's because we know some people call 999 who shouldn't.
Yeah.
So there was more moderation and people were more reluctant to call 999. But if you get ill, you get ill.
Why won't the government talk to the junior
because
doctors?
35% because 35% is ridiculous.
Yes, but we had this with the nurses' strike. And on this programme, again and again, for about 4 weeks, we had government ministers, the spokesman of the day, saying we are not talking to the nurses until they call off their action. And we said to them, I actually had a bet with one of them. I said, you will.
Yeah.
You will.
Yeah.
And they did. And we know that in the end, they are going to talk to the junior doctors. So why don't they just cut to the chase and do it now?
I think the junior doctors will have to come down from 35% because they're
from 35%.
They want 35% pay rise.
You know they will. Look, ministers have been boneheaded and stupid here. And what's one of the reasons the public aren't on their side. And the same with nurses. No, it's got to be next year, not this year. It's an independent peer review body. You question the independence of it. And then all of a sudden, they did what they should have done at the beginning, and we could have saved all those days' strike, all those days' strike. Steve Bartley, the Health Secretary, Jeremy Hunt, the Chancellor, Rishi Sunak,
they find money down the back of a sofa.
Get out of their bunker and just start meaningful negotiations.
Churchill said, isn't it? George Law is better than war.
But they're right, though. I would have thought from the PR, the presentational point of the government, there were some tentative discussions. You'd be better saying, look, we're desperate to get them round the table so we can get them back round operating tables. We want doctors back at work. Instead of saying, no, they're asking for too much. No, that's it. Go away.
Yeah, it's also the most extreme strike. We've had 4 days in a row. We've never had that before, and that's why it's going to cause maximum disruption. Also, it's cynical, if you don't mind me saying, doing it straight after bank holiday when already services are at a lower ebb because people have been away. So it's going to cause... It's not just 4 days disruption. This is going to be a week and a bit.
It is. Anthony on Twitter says, I should be having a bypass operation today. Heart bypass, isn't it? He's talking about. I should be having a bypass operation today. I put the blame entirely in the government for not receiving it. I think he means not receiving them. If they're going to have to talk to the doctors eventually, but like the nurses and ambulance workers, they have to drag it out and put misery on thousands of people. He seems to be blaming the government for dragging it out, Kevin, as you say there.
I hope Anthony's OK and Anthony, you get your operation soon and everything's fine. But it's... Some Conservative ministers kind of have an old 19th century mill owner attitude still. And it's that workers just have to do what they're told. When it's not, you've got to get the two sides. It's all about a partnership and cooperation.
Let's bring Hills in here. We were asking, we want to have your views at home this morning, particularly if you're affected by the cancellations. That's what we want to hear from this morning. And you are already in touch with us as you're hearing. Stu on Twitter says, I was due to go in today to have a major operation on my left lung tomorrow, as they suspect I could have cancer on my left upper lymph node. And Stu says, I do support the strike, as all the staff work very hard and need to be paid better. But why do it for a week? Hills, why do it for a week?
Why a week? I think they're desperate. I think morale is so low. I think that they feel the government has not responded in all these years. For years and years, they've been trying to increase the pay of doctors, junior doctors. We call them junior doctors. I don't know why, because they could be 10 years, doing really responsible jobs. Let's just abandon that phrase. They're doctors. They're doing very responsible jobs, saving lives. And they're just at their wits' end. They can't afford to live, some of them, because they're on... we saw the BMA ad, £66 for three doctors to perform an appendectomy. I mean, that is just crazy.
They're very smart. Clear, doctors are smart. But I think the way they are managing to cut through to us by actually comparing what we might think is acceptable pay per hour. The idea that you could be paid £14...
That was disproved, actually.
Was it?
Yeah, the fact-checking service, what's it called, the independent checking service?
I'm not sure it has been disproved.
They said because the only junior doctor would get that is who never worked at a weekend and never did a shift pattern. They said, in fact, there's probably not a single junior doctor earning that. the average would be between £20 to £30 an hour. That's what...
But it is generally accepted, though, that they are underpaid
They're
for
underpaid,
what they do.
but,
Yeah.
but
I think everybody accepts
that. But that claim that they were getting less than a barista was
the BMA
rejected.
have used it in their advert. I don't think the BMA...
Well, I'm just telling you, Kevin, what the Independent Checking Service, which you quote all the time...
I don't know which one you mean.
You do know the one I mean.
Well, look, can we agree? Let's agree to differ on that, because I want to come back to Hillary.
They said it's not
I don't want to tempt fate here, but the fact of the matter is that people are going to have accidents today.
Sure.
People are going to fall off ladders. They are going to tumble downstairs, and people are going to have heart attacks. It's going to happen. What can they expect when they get to their local hospital?
OK, when they get to their local hospital, there's going to be a lot of waiting. It's bad enough before the strike. 12 hours in many A&E departments is the norm now. It's going to be much worse than that. So they could be on a trolley in a corridor waiting for the consultant who's covering the junior doctors to come and see them, assess them and see how urgent their case is.
What if it is obviously life-threatening, though? Supposing, for example, in 10 minutes from now, I fell off my chair with a heart attack. Am I going to get the same treatment at the nearest hospital as I would have got a week ago?
No, you're not.
I'm not.
You're not. I mean, you're going to be in a queue with others in the same situation. And this is disruptive. This is dangerous. It's never been more dangerous.
So are people going to die as a result of this strike action today?
Yes, they are.
As a direct result of the strike action?
Yes, I believe they are, because treatment will be delayed. You know, you can't... If you've got one doctor there trying to look after 10 patients and they're all acutely ill...
The fact of life.
You know, you can't get to them all at the same time.
And how do you feel about that as a doctor who's taken the Hippocratic Oath?
Look, we don't take the Hippocratic Oath anymore. I mean, that's a bit of a myth, but there is the basic tenet. We don't actually sign anything.
Okay.
There is the basic tenet is, above all, do no harm. The problem is that the doctors' mood at the moment is that unless they make a stand, it will just carry on. We will lose staff, we won't be able to retain staff, there will be no NHS. They're striking as much to preserve the NHS as they are to increase their pay. And both of those things are important. The real question for me about the whole of this strike is, whatever they're paid, whatever they come to an agreement around the negotiating table, will it be enough to recruit enough staff into medicine and retain them? Because otherwise, we're not going to have an NHS in 10 years' time.
But medicine is a vocation, isn't it?
Well, you could say that about anything. You know, it's always been the case of... If we extrapolate that argument, why not ask doctors to do the work for nothing? You know, because it's a vocation. That's crazy. You've got to pay them what they're worth. They're doing a responsible job. And, you know, they take exams for forever to get there, and they're treated like this by the government. And I think the government have to say, we need to sort this out quickly. We need a long-term plan to retain staff, recruit them, keep them,
Can I ask
keep them
you,
happy.
Hillary, if you... Well, it's a difficult question to answer, but if you were... younger today, you don't mean it that way. So if you were making a decision about your career today, would you still make the same decision? Would you still become a doctor today?
I would think very carefully about it now. I really would. I think medicine has changed dramatically since I first started in medicine. It used to be fun. It used to be a satisfying job. You used to go home, know you've made a big difference, a good difference. Now, I think a lot of doctors go home and think, why am I putting myself through this? And it's changed so much.
It's funny, I asked...
We need to look at that.
I asked my missus what her opinion was about this a couple of days ago, and she said something which I think was quite sort of penetrating. She said, it's not really about the pay, it's about the National Health Service. We've had... The unthinkable has happened in the last few months. We've had a nurses' strike. We've now got a junior doctor strike. Unprecedented. Never seen anything like it before. Surely this is a symptom of a National Health Service that is in desperate need of an overhaul.
Well, it's just not working. And we had a 3-day junior doctor strike in March, 170,000 appointments, cancellations, and so that's going to have all sorts of impacts on people's health. This is going to be so much worse.
And it's not just this week that'll be affected. This will be a month or 2 months.
Oh, it'll knock on, won't it?
Caught up with the backlog, which was already 7 million patients.
And they're now saying, the Junior Doctors Union is now saying that they are, if this doesn't get settled, they're going to target bank holidays. They're going to actually have more strikes after bank holidays.
Maybe it's the sympathy of having a political party running the NHS which hasn't looked after it for the last 13 years. And I'll say again, you look, the government, when Cameron was there for more than 6, I think it went into 7 years, put the tightest financial straitjacket on the NHS in its history.
And who was the health secretary then? He's now the Chancellor.
Jeremy Hunt.
You know,
Yes,
in my opinion, you have to take the NHS out of party politics, and you need somebody really brave to make difficult decisions about where the NHS is heading.
Yeah.
Yes.
Because it cannot perform all the things it's being asked to do. The expectations are too high.
Agreed.
There isn't enough money to do that. So one brave person who's not a party politician...
Yeah.
They don't exist because it's all tied up in the
And I
in
think
the general
culturally,
election.
as a you know, growing up in this country, our mindset is such that we expect everything from the NHS.
Absolutely.
We think that we can. It's a difficult thing to say. I think we can drink ourselves silly, we can smoke ourselves silly, we can eat, overeat, we can do all the things we want to do.
And
But the
it'll
NHS
sort
will
it
pick
out.
us up in the end. I'll be able to go to my doctor, and I'll be able to. They can look after
They'll
me,
fix it.
and I don't have to take any responsibility for myself.
Look, if you go to see your doctor, he'll tell you not to drink as much and don't overeat.
No, I
don't
agree,
smoke.
but we don't have any...
There are lots of preventative
I
programmes
think that our mindset has
now.
become
I don't know.
such that we
Doctors
think we can
Yeah, I think
expect
so.
the NHS to look after us no matter what we do to ourselves.
No, but if you,
There is
but
a
if-
mindset, and I
Sorry
agree
to
with
say
that.
it, because
There
it's
is a
unpopular
mindset
to
like
say
that.
it.
Look, we've all got to take some personal responsibility, but if you're ill, I think you're entitled to expect the
illness,
NHS
yes,
there
no, yes.
or you have an
But do you know what?
accident.
There's-
But here we will know
pay
It's
for
a
it, you
bigger
know.
issue.
We do pay for it.
But here we
Yes,
know the
we
GP
do.
surgeries that get the same phone calls from the same people want to keep coming into the surgery all the time.
I do want,
Yeah.
I want to ask Hilary
I'm going to get a lot of people
question.
angry with me this morning, I'm afraid.
Is it true that when a GP asks a patient how much they drink, whatever the answer is, the GP in their head doubles it?
Well, they're very wary of what the truth is.
Yeah.
You know, just one point I'd like to make is that the cost of paying doctors a decent wage would pale into insignificance compared to what we pay the legal compensation
Very good
for
point.
When things go wrong.
for claims, when things go wrong in the NHS. If we had a system like they have in New Zealand, no-fault system, where doctors aren't necessarily punished, and it's not the lawyers that get the money, it's the patients who are injured, you know, we would save all the money and be able to pay that to our junior doctors.